I was looking through some recent comments on the channel, and there is one thing that keeps coming up over and over again this month. People are opening their Social Security statements and realizing the numbers just don't add up. Their cost of living adjustment was supposed to help them keep up with inflation, but instead, their monthly deposit actually feels smaller than it was last year. If that's you, I want you to know you aren't imagining it, and you definitely aren't alone. We are currently navigating a massive shift in how Medicare is priced, and as of May 2026, we are seeing the full impact of some of the biggest cost increases the program has ever seen. For the next 20 minutes, I want to talk about why this is happening, and more importantly, what you can actually do about it. We aren't just talking about a few dollars here and there.
We are talking about a fundamental change in your monthly budget. We're going to look at the new Part B premiums, the trap hidden inside the 2026 deductible, and a new pilot program that is making it harder for seniors in 6 specific states to get the medical equipment they need. My goal is to make sure that by the time we finish, you have a plan to protect your wallet for the rest of the year. Let's start with the big number that everyone is talking about, $200.90. That is the new standard monthly premium for Medicare Part B in 2026. If you remember back to last year, we were paying about $185. That's nearly an $18 jump per month. For a couple, that is almost $40 a month taken straight out of your household budget. When the government announced the Social Security COLA increase, they didn't spend a lot of time talking about how the Medicare premium increase would eat most of that raise alive.
It's frustrating because it feels like the system is giving with one hand and taking back with the other. Why did it jump so high? The official reason is that more people are using the system, and the cost of new treatments, especially those expensive weight loss and heart medications, is putting a strain on the budget. But honestly, knowing why doesn't help you pay your electric bill. What matters is knowing that this $202.90 is the floor. If you have a higher income, you might be paying even more because of the IRMAA surcharges, which also went up this year. If your income as an individual is over $109,000, you could be looking at a total premium closer to $650 a month. I've talked to many retirees who were just a few $100s over that threshold and had no idea their Medicare bill was about to triple. Then we have the deductible. In 2026, the Part B deductible is $283. That is the amount you have to pay out of your own pocket before Medicare pays a single dime for your doctor visits or outpatient tests. It went up by $26 this year. It might not sound like a lot, but for someone living on a fixed income, having to find an extra $280 in January or February just to see their specialist is a real hurdle. I see a lot of people skip their early year appointments because they don't have the cash for that deductible, and that is a dangerous game. Skipping a screening in February can lead to a hospital stay in October. Now, I want to talk about some of the good news that comes with a catch. You've probably heard a lot about the new $2,100 cap on prescription drugs for Part D. This is a huge milestone. For the first time in history, there is a hard limit on what a senior can be forced to pay for their medications at the pharmacy. Once you hit that $2,100 mark, your plan pays 100% for the rest of the year. For people on cancer drugs or specialty treatments, this is life-saving. It means you no longer have to choose between your medicine and your home. But here is what they don't mention in the flashy commercials. That $2,100 cap only applies to drugs that are on your plan's formulary, the approved list. If your doctor prescribes something that isn't on that list, or if the plan decides to drop a drug mid-year, the money you spend on that medication doesn't count toward your cap. I've seen people spend $5,000 on a drug they thought was covered, only to find out it was a non-preferred tier, and their progress toward the cap was zero. This is why May is the time to do a medication audit. If you aren't already halfway to your cap, check your plan's portal to see exactly which of your prescriptions are counting and which ones aren't. Speaking of things that aren't quite what they seem, we have to talk about a new pilot program that just launched this year in 6 states. If you live in California, Florida, Illinois, New York, Ohio, or Texas, you are now part of a prior authorization experiment for certain Medicare Part B items. This means if you need something like a specialized wheelchair, a CPAP machine, or even certain types of skin substitutes for wound care, your doctor can't just order it. They have to get permission from Medicare first. I genuinely don't know how to feel about this one. On one hand, the government says they are doing this to stop fraud and overspending. On the other hand, it means a senior who just came home from surgery might have to wait 2 weeks for a piece of equipment that used to arrive in 2 days. If you live in one of those 6 states, you have to be your own loudest advocate. If your doctor tells you they've ordered something, you need to ask them immediately, has the prior authorization been submitted, and what is the tracking number? Don't just sit by the phone waiting. What really gets me is the observation status trap that is still catching families off guard in 2026. I know we've talked about this before, but with the hospital costs going up, it's more important than ever. If your parent is in the hospital, the bill for their room can be over $1,700 for the first 60 days, but only if they are an admitted inpatient. If they are under observation, they are charged under Part B rules, which means you pay 20% of everything. If the hospital bill is $20,000, your 20% is $4,000. That is a massive difference. You have to ask the staff every single day about their status. It feels like you're being a nuisance, but that one question can save you thousands of dollars. So how do we fix the shrinking check problem? If you are struggling with that $202.90 premium, the first thing you should do is check the 2026 eligibility for Medicare Savings Programs, or MSPs. These are state-run programs that can actually pay your Part B premium for you. Because of the new spending bill passed earlier this year, the income limits for these programs were raised in many states. I've talked to people who thought they earned too much last year, but under the new 2026 guidelines, they actually qualify for help. If you can get your state to cover that $202 premium, that is a $2,400 raise for your household this year. Another thing to look at is your Part D plan for next year. I know we are in May, but the decisions you make now affect your 2027 budget. Because of the new $2,100 cap, many insurance companies are raising their monthly premiums to make up the difference. I'm seeing some drug plan premiums double for next year. If you are in a plan that used to cost $30 and now it's $60, you have to shop around. Don't just let it auto-renew. The loyalty you feel to an insurance company isn't being returned. They are looking at their bottom line, and you need to look at yours. I also want to mention the new Advanced Primary Care Management Services that Medicare started paying for this year. This is a bit of a hidden gem in the 2026 handbook. Medicare now pays your doctor a monthly fee to coordinate your care, give you 24/7 access to your care team, and help you navigate your medications. If your doctor offers this, take it. It's a way to get more value out of that $202 premium you're already paying. It makes sure you don't have to wait for an appointment just to ask a simple question about your health. The reality of 2026 is that the American healthcare system is becoming more of a do-it-yourself project for families. You have to be the one to check the premiums, verify the deductibles, and fight the prior authorization delays. It isn't fair that after a lifetime of work you have to spend your retirement being a part-time insurance billing expert. But knowing these rules is the only way to keep your money where it belongs, in your pocket, not the insurance companies. I keep coming back to the idea that information is the only real shield we have. When you know that the $202.90 is coming, you can adjust your grocery budget or your travel plans before the check arrives. When you know about the $283 deductible, you can set that money aside in January so it doesn't feel like a crisis. It's about taking the surprise out of the system. I'd really like to hear from you. Have you seen a drop in your Social Security deposit this month? Did the Part B premium hike catch you by surprise, or were you prepared for it? Hearing how you are adjusting your budget helps everyone else who is trying to do the same thing. We're all trying to make the math work in a system that seems to change every few months. Remember, the 2026 handbook is a long read, and most of the important stuff is buried in the back. But you don't have to read it alone. We are going to keep breaking down these news updates and bill changes as they happen. Whether it's a new Medicaid expansion in your state or another pilot program from CMS, I'll be here to walk you through it in plain English. Protect your paperwork, keep a close eye on those Social Security statements, and always ask one better question before the next decision. Taking these 20 minutes today to understand the math behind your check is the first step toward taking control of your retirement. I'm so glad you spent this time with me. I'll see you in the next guide.